Okay, so today we're going to talk about hemostasis. So let's start with what is the definitions of hemostasis, and simple definitions of hemostasis, which basically means that it's a precisely orchestrated process in which you have, let's say, endothelium. You have platelets, platelets, and also your clotting factors. Okay. So the process in which there's requirements of endothelium or platelets or clotting factors. Okay, they come, and what they do is with their certain steps of reactions. Okay, what they do is they play an important role in forming this fibrin clot. Okay, depositions of this insoluble fibrin molecules in order to prevent the blood loss. So basically, the hemostasis means that the process in which requires all these different endothelium, platelets, and clotting factors at the site of the vascular injury in order to stop bleeding. That is called hemostasis. But guys, hemostasis is not same as homeostasis. All right, homeostasis is this with H-O. It's not homo, guys. You gotta pronounce it correctly. It's homeostasis, which basically means that homeostasis basically means is that maintaining the constant maintaining of internal environment. It's called homeostasis. Okay, so these are two different things. All right. Now, like certain things we have to be very, very clear about is that some of the definitions we have to be very, very clear. Like for example, like let me write down some of the steps that we have to be very, very clear at the end of this class. Coagulation. What does that mean? All right. We have to define what coagulation means. We have to define what is primary hemostatic plug means. All right. We also have to define what is secondary hemostatic means. Okay. We also have to know what is platelet adhesion means. We also have to talk about platelets aggregations means. All right. You should know about what embolus means. Okay, we also have to talk about clot retraction means. All right, and we also have to talk about fibrinolysis, which basically means, what does this means? I might have spelled this incorrectly, but as we go and as we try to talk about it, I hope that I can help you make this very, very clear. All right, we have to be very, very clear with what are this process, what are this. All right, so let's start with talking about what is coagulation. What is coagulation? How do we define coagulations? Guys, one of the most important things you have to remember is that coagulation is a process of, it is a property of plasma. All right, the coagulation means. The reason why being is, let's say if I'm going to make a simpler thing, let me make this. Let's say if I put in this tube, if I put a blood, right? So if I put a blood and if I slowly centrifuge, obviously what are you going to have all this red blood cells coming down here, right? All this red blood cells coming down here, all right? And this is called what? This is called hematocrit, right? We call it packed cell volume. And then like down here, you also have like a little bit of buffy coat and all that stuff. And all this thing is going to be my plasma, right? And then remember, guys, plasma is usually like 92% of plasma is made out of water, right? And there is about 6-7% you have proteins, and this plasma contains your clotting factors, guys. That's why we say the coagulation is a property of plasma. All right, but guys, you guys have to also be very clear about this. Plasma is not same as serum, okay? Because serum is completely different. Because plasma has the clotting factors, so because of that, they can able to coagulate. But serum, what is serum? Is that, remember, when you take the blood out, really what happens is the blood gets thickened, right? And it becomes like a gel, okay? So from the gel, whatever the fluid comes out of gel, that is called serum. Like for example here, serum would be like your plasma, okay, minus the clotting factors, your clotting factors. So serum cannot coagulate itself. That is serum. So serum would not able to clot. So these are just a general concept that I wanted to let you guys know. All right. So now, before we even talk about what causes what causes clot to form or thrombus to form, let's talk about normal. Let's talk about why in our body right now, in our circulatory systems, because our circulatory system, closed circulatory system, right, which basically means that your blood is in liquid form, and it is because it's closed circulatory system, meaning that all the bloods are actually running around in your blood vessels, right? So why our blood is not coagulating right now? Why are they in liquid form? Okay, what is the mechanisms that helps us to help the blood in a liquid form? What is the mechanism? Let's discuss about that. And once we discuss and once we understand the normal mechanisms, then we'll go very detailed about what are the causes that will help the process of hemostasis begins. Okay, so let's understand normal first, and then we'll go about the vascular injuries and then we'll talk about the hemostasis. All right, now let's talk about this. All right, let me make this let me make this in a green. I'm gonna make this okay, actually let me make this in a red. All right, so what is gonna happen, I'm gonna make this as my, let's say this is going to be my blood capillaries, right? This is going to be my blood capillaries, all right? Making one vessel, guys. All right, making one vessels, and right there, right here, right? All right, making one blood vessels, and let me make like in this lining, you know, right? Actually, I'm gonna make this here. This is gonna make like I'm making a endothelial cells here, guys. All right, and then in here, right here, what I'm gonna make is let me make this the basement membrane right here, okay? Because they're basement membranes, and then look, what is basement membrane? What do you contain here? You have a lot of this like collagen fibers, right, guys? And you guys have probably already learned about the collagen synthesis, the importance of the vitamin C, guys, all right, or glycine amino acids. So I'm making this the fibroblast protein, where they have a lot of collagens and a lot of connective tissues, right? That's what it is. And then obviously there's one more thing I have to make is like you also have to understand, right? They're like, what are this? Like smooth muscle cells, all right? Smooth muscle cells, all right? Okay, guys, it's like these are smooth muscle cells in my black, all right? And this is, I made a single layer of endothelial cells, and then you know the endothelial cells have like this little granules in there, right? In this blue I'm making. You know what these granules are called? These are called Weevil. I'll write it down there, all right? These granules are called, let me write it down here. These are called Weevil pallid bodies, all right? And then we'll talk about what it means later. But maybe I might have spelled this incorrectly, but guys, check the spelling, all right? Don't go with the spelling. Try to understand the concept here. All right, so this is the normal healthy endothelial cells, right? I do some collagens, I do some circular smooth muscle cells, and we're gonna talk about it, right? So when we're talking about the process of, right now we're talking about the process of what is the systems in our cardiovascular system, in our circulatory system, that our blood is in liquid form, right? That's what we're discussing right now. So first we have to understand is that, all right, in a normal condition, really what happens is that in continuously, like every day, every single day, what is happening here is that your healthy endothelial cells, you know, they're continuously producing this thing right here, look. This is called nitric oxide, right? They're continuously producing nitric oxide, right? And what else are they producing? They're also producing this prostaglandins, actually. There's one form of prostaglandins, but it's called PGI2. We call them as a prostacyclin, right? And also they're producing what is called adenosine diphosphate, all right? This is what they're producing, right? adenosine diphosphatase actually. It's not diphosphate, it's diphosphatase, guys. All right. So really, what happens is that, look, they're continuously putting, and the nitric oxide prostacyclins adenodiphosphatase, what happens is this prevents like platelet aggregations. These are called antiplatelets. And I'll explain why they're called antiplatelet. These things are, right. They're called antiplatelets, or they are preventing antiplatelets, right. What they're doing is that whenever the platelet comes, let me make this platelets in a different color. So do you guys know what the size of platelet, guys? Usually the size of platelets are like about 2 to 3 microns, right? And then they last for 8 or 10 days, about that, right? And you guys know, like if you have done hematopoiesis, these platelets are coming from like the megakaryoblast, right? What happens from the megakaryoblast? Those like finger-like projections are coming out, right? And then when the blood passes through rapidly in the bone marrow, what happens is that those finger-like projections kind of sort of gets off or removes from there, and we call them as a platelet, right? And these platelets, what happens is that platelets have receptors like located in down here, right? Platelets have receptors located here, like some of the receptors of platelets are going to be like have a GP. It's a glycoprotein. Let me write this in a little bit. You have a glycoprotein 2A, right? That's like the glycoprotein. There's a 2B, and then there is a 3A complex, and this will be probably glycoprotein 1B, that kind of stuff, right? So what really happens is, what this nitric oxide, what they do is like whenever they come in, whenever platelets try to come in there, what happens is nitric oxide, what they do is, this adenosine diphosphatase, what they do is they were able to inactivate these receptors that's located on your platelets. So when they inactivate these receptors on the platelets, what happens is that this platelet will no longer be active, right? No longer, so they will no longer able to bind into this. Because remember, guys, this adenosine diphosphatase, look, ADP, adenosine diphosphate, it favors platelet aggregation, right? But what happens with this adenosine diphosphatase, it breaks down the phosphate from there, right? Because that's why it's phosphatase. So because of that, that inactivate this receptor. Because of that, these guys would not able to bind into it. This is the one way that every single day. This is the one way for the platelets is not able to bind into, because your healthy endothelials are continuously producing these factors, nitric oxide, prostacyclins, adenosine diphosphatase, right? Now, that's what these guys do. And there are also some other factors that healthy endothelials are going to produce. Those healthy endothelials produce, what are these called? There is something called, they produce from the surface of this, guys, it's called heparin-like molecules. What is it called? It's like heparin, HEPA. It's a heparin-like molecule, right? And then they always produce these heparin-like molecules. And whenever this heparin-like molecules get produced, what happens is that there's this important compounds, all right? This compounds, like whenever this heparin-like molecules gets releases from healthy endothelial cells, something else like this compound called, let me make this as, which is called antithrombin number 3. All right, this gets activated, all right, and this antithrombin, what does it do? Oh my God, this guy, what it does is that it breaks down the thrombin, right? It breaks down the activated thrombin, right? So what it does is that it inhibits thrombin. That's what it does. All right, that's what it does. And then it also, what it does is that, because remember, these guys, antithrombin, what it does is that these are going to be anticoagulant. This mechanism called anticoagulant, what it does is that, whatever the factors, that activated factors, what it does is that it destroys them. So it makes those activated factors lower in level in your blood circulation, right? So this, especially this antithrombin 3, this will inactivate your factor number like 9. All right, it also inactivated factor number 10, and what is also inactivated factor number 11, and also factor number 12. Okay, guys, let's name this. When you're talking about factor number 9, what is the factor number 9 means? Okay, the factor number 9, it's called All right, you should know this name, guys. All right, this factor number 9 is going to be, and I'm going to write down later down. The factor number 9, we call this as the Christmas factor, or there's another name is given for that. It's anti-hemophilic B. All right, and then factor number 10. What is the factor number 10 is? It's going to be storage factor or a Brouwer factor, or that's what it is given for that one, right? And then your 11. What is the 11 is well, we often call them anti-hemophilic C is given for that, right? And then there is another name is given for that, which is going to be my plasmothromboplastmin antecedent, right? Which PTA we can call them. Later I'll write down about this. This number 12 is called Hagman factor, or the contact factor, or the glass factor, or the anti-hemophilic factor number D, we call them. So basically, this antithrombin does is that it will able to inhibit this activated, these are activated factors number 9 and 10, 11, 12. That's what this antithrombin does, right? So because of that, these are anticoagulant, right? So antithrombin 3 help us prevents procoagulant, which means like procoagulant means it favors coagulation, but because of the antithrombin, it destroys the thrombin as well, right? Now, what else is going? Now, there's also one other thing that this healthy endothelial cells produces. What is that going to be? You know, this molecule is called thrombomodulin. All right. So what happens is like the name itself tells what it is. Basically, what it is, it's modulates thrombin so much that thrombin becomes activated, and when the thrombin becomes activated, what happens is that it will activate these different types of proteins, like this, and this is going to be my protein C actually. But remember, guys, in order for protein C to get activated, it required a cofactor, and that cofactor is going to be my protein S. All right, this protein S, it's a glycoprotein. It's a vitamin K dependent glycoprotein, and so this is required for in order to get activated protein C. And guys, there is a clinical correlation related to this. Like if there is a protein S deficiency, then what happens is that you're not able to activate protein C, right? So what happens is that sometimes this can lead into the abnormal blood clotting. So there is a clinical correlate with this, all right? All right, and then this factor number of protein C, what does it do? Obviously, it modulates the thrombin, and it will able to destroy your factor number, your 5 and your factor number 8, right? And what is factor number 5? What is the name for the factor? We call them as a let me write this down. Labile, Labile factor. We call them as a Labile factor, right? And then there's also another name is given for this one, Labile factor 2. What is that? What is that going to be? It's going to be, you can call proaccelerator, you can call this. And this factor number 8 is going to be, what is going to be factor number 8? It's going to be my anti-hemophilic B, guys. Sorry, it's A. It's anti-hemophilic and we'll go about this when we talk about the pathway. We'll talk about what are this each means by, right? Now, and this protein C is like inhibiting or destroying this activated factor number 5 and 8. That is what these guys are doing. All right. Now, what else is? And this is and because of this healthy endothelial cell is checking, making sure that you know there's a low amount of like activated there's low amount of activated factors are in the blood circulations by producing all these heparin like molecules, antithrombin, so that way it keeps in check also, right? Now there's other things like, look, what happens is the healthy endothelial cells also produce like this tissue factor inhibiting a pathway, it's called, right? And the tissue factor inhibiting pathway, it's what it does is like it inhibits your extrinsic pathway, which inhibits your tissue factor, right? And also it inhibits your factor number 7, guys. And what is your factor number 7 is? Factor number 7 is going to be a stable factor, right? We call them a stable factor for this one. Or you can say this is like it's also called SPCA. What does this mean? Serum plasmin conversion accelerator, all right? That's also another name for is that, and that's what TCU plasminogen inhibiting factor also does that, right? Now, so so far that we talked about we talked about this, the role of this, what healthy endothelial cells are producing, right? So this is a process in which that your blood circulation right now, your blood is in a liquid form because of this cascade, all right? Because it's because this is happening to you right now. That's the reason why your blood is circulating in liquid form, because your healthy endothelial cells are producing these products. All these products are very, very important for your blood in a liquid form. And also one more thing is that whenever there is what is also happening is like during the process, really what happens is this concept of like procoagulant, right? There's a procoagulant and then there's anticoagulant. Procoagulant and what does this mean? Basically mean is that procoagulant basically means is that it favors the coagulation process. Anti means that it does not favor the coagulation process, right? And these guys are what? These guys are anticoagulant, and usually in the normal healthy endothelial cells or in the normal blood circulation, what happens is that this anticoagulant is dominating, right? That's the reason why your blood is in a liquid form right now. And that's what these guys are doing right now, right? So this is the normal mechanisms, right? So now we have to talk about in what conditions, like in what condition will have like this coagulation process will start, and we'll talk about that, right? Now we'll talk about this. Let me erase this again. All right, we'll talk about all these things in very detail now guys. All right. Now what is going to happen is like, okay, so what are what are some causes where this process could start? There's something called Varcostride, like they call this Varcostride, right? What is Varcos? I don't know how to spell this. They call Varcostride. I think it's I don't know how to spell this, guys, but I want you to look this up, all right? It's called Varcostride, which basically means is that the three usually process where there is a it's called Varcostride. One is called like your endothelial injury, like there is a endothelial injury, all right? The second thing is like a stasis, STA, a stasis, or like turbulent blood flow, right? And the other one is called hypercoagulability. All right. So in general, concept as Varcostride, these are usually leads into like having this hemostasis form, right? So what happens is like whenever you have sort of like traumas, or let's say sort of traumas or certain cuts, current cuts, or even like sometimes what happens like if you're sitting right next to people who smokes, and then if you inhale the smoke particles, they go absorbs and they can destroy your endothelial cells. So your endothelial cells could be dysfunction, right? That could be, or sometimes like you have a turbulent blood flow, like rapid blood flow, that could also can rupture your endothelial cells, right? Like hypercoagulability basically means sometime in a coagulation process you have deficiency on, let's say, protein S, or deficiency on, let's say, vitamin K, or the deficiency on certain factors, clotting factors. And if that case happens, then what happens is that your blood, what happens that could also coagulate, and you could have like hypercoagulability, because if you have certain like factor or deficiency, then what happens is that they could come together, and then they could form a clot. Okay, that could do, or sometimes like let's say. So that's what hypercoagulability basically means, right? Or sometimes you have let's say any sort of like the cardiovascular problems, like myocardial infections or something. So what happens is like certain types of the blood vessels, because of the cell death, and when the cell try to remodel, right, they could create aneurysms around there. Okay, so there are a lot of processes in which, like, these endothelial cells could get injured. So that's why this term work with stride is used to understand that what are the conditions that what causes this coagulation process could start, right? That's why I just wanted to briefly tell you guys about it. And also radiation, guys. The radiation is also could lead into endothelial cells. But one of the most important concepts you have to understand is that, this obviously, if the small vessels are cut, then yes, or if the cut is small, then yes, then your endothelial cells, or the way your body works, the body can fix the mechanism by creating the clot. But if it's a bigger vessel cut, then your body would not able to maybe fix that or stop the bleeding. So in that condition, yes, you do need a medical interventions or surgical intervention to stop the bleeding. All right, but we're talking about the minor cuts or some kind of minor problems that's happening within your body, and that's why your healthy endothelial cells produces, or the clotting factors, they help to form the clot, so that way they prevent from bleeding. Okay, so that's what they do. But now, anyways, now we'll go and we'll talk about this in more detail. All right, so now let's just take examples of, okay, what happens is like, you got a trauma or you got a small cut, right? And then let me make this as endothelial cells right here, right? Alright, so now making this endothelial cells right here. Alright, and making this endothelial cells. Alright. Okay, so really what happens, and obviously guys remember that there's going to be a basement lamina and there's going to be this collagen fibers here, right? Collagen fibers, maybe like make this all this collagen fibers like this, right? Now, and all of them is going to be down there too. Alright. Now, what else is going to be? Obviously, I have to make the smooth muscle cells here too. All right, and then let me make this smooth muscle cells more like circle right here, like right there. All right. Smooth muscle cells, right? Look. Now, let's say suddenly, like, what happens is that, let's say you got a cut, all right, and then you healthy endothelial cell got injured right here. Look. So now, when you have a healthy endothelial cell got injured, really what happens is like, look, and here, let me make this platelets right here. Let me make this as a platelets right here. Look, a lot of these platelets are in your floating right here, right? Like, look, this, when the healthy endothelial cells got injured, that means like this area is exposed now. So when this exposed, what happened? The collagen started coming out, right? The collagen will start coming out here like this. Look, this collagen will start coming out here like this, exposed here, right? Collagen. And remember, the platelet loves collagen, right? They want to always stick with the non-surface area, all right? And then what happens is that this healthy endothelial cells, when they're injured, what happens is that these healthy endothelial cells, what happens is that this injured endothelial cells, what happens is that they contain granules, right? Remember I talked about they contain granules, something called cerebral palate bodies. They really have, what happens is that when they get cut or injured, really what happens, those damaged healthy endothelial cells, they started producing this very, very sticky substance, okay? This very, very sticky substance they'll produce. And they'll sort of like paste like on this underlying, on this non-surface, right? What is a paste-like substance? And that is usually stored in these cerebral palate bodies. And those very, very sticky substances called, let me make this V, W, and then F. Let me make this. This is very, very sticky substance that loves to bind to the non-surface area here. It's very, very sticky right here. And also, it likes to hook with something too, right? And this is VWF, which is called von Willebrand factor, all right? It's called von Willebrand factor, all right? That's what it is. Now, this von Willebrand binder, it's like loves to sticky. It's like a sticky glue, right? And that is coming from this injured endothelial cells is producing that, right? So what happens is that when the platelet comes, and when this is the platelets, as they come and then when they contact with these collagen fibers, what happens? The platelet gets swollen, okay? Platelet gets swollen, and as they pass in the collagen, as they're getting bigger and getting swollen, what happens? They touch this VWF. remember the VW is a sticky glue, and as soon as when they touch this, what happens is that these platelets have receptors here, okay? These receptors are called GP, glycoprotein 1B, all right? And what happens is this, as soon as when they touch this receptor, they stick with this VWF. Okay, the GP1B, they stick with this BWF. Guys, you have to understand this, right? Remember, there is a clinical, sometimes like what happens with the platelets, there are people, sometimes the platelets are there, but sometimes they have this receptors are deficiency, okay? They don't have the deficiency, and then if you don't have the receptor deficiency, really what happens, there's a clinical pathology. It's called Barnold-Solier syndrome. That's what they called, all right? So these guys come and stick together. So when the platelets, when they stick with this VWF, which is non-surface here, this process is called platelets adhesion, all right? So now let me make this platelets and then sticking with this one, okay? This is going to be, and there's going to be obviously, let me make this right here, and then this is going to be my B1B, right? So when they stick with this one, they kind of hooks it with it, right? So they get attached with it, they bind with it. So when the platelets bind to the VWF, or they bind with the non-surface area, which is going to be VWF, which we call this process platelets adhesion. Platelets adhesion. I'm going to write this down. I'm going to write this sucky right here. I'm going to write this sucky right here. It's called PLATELE, platelets adhesion, all right? Don't get confused with this, all right? Now, then really what happens is that, now same thing will happens. So then one day the binds with this platelets, because remember platelets contains what? Platelets have the granules and all, right? And then in the platelets, what happens? This receptor start stimulating these cells, inside the cells, and really what happens is there's some pathway leads into this. And let me draw this pathway right here. Come on, follow this guys here. Let me draw on the this platelets. Let's make this platelets a little bigger right here. Actually, what happens is that when this GB1B gets stimulated, really what happens is that, okay, let me put it down here. Let's come this way. There's GB1B, right? There's what happens is that there's some enzyme, okay? This enzyme is very important. It's called phospholipase A. There's a membrane phospholipids around here. The phospholipids that are bound with membrane, that's what it is, all right? They go process the esterifications of arachidonic acid. So this membrane phospholipids, what happens with that is on the presence of this enzyme called lipase, okay? Phospholipase A2, it's called phospholipase A2. What it does is that it kind of sort of like, it's phospholipase. It's phospholipids. It's esterified this membrane phospholipids, and it converts into arachidonic acid. It's called arachidonic acid, right? And then, guys, this is important because remember, there's some like corticosteroid drugs can inhibit this. Glucocorticoids can inhibit this phospholipase A2, all right? And then after this arachidonic acid, it can have two pathways it can go into, all right? One is called cyclooxygenase pathway, all right? And then which lead into forming of like thromboxane A2, and also like prostaglandins like PG, different type of prostaglandin, prostacyclins, or they'll form that. And then there's other one is called lipooxygenase pathway. It's called lipooxygenesis pathway. And then what these guys do is that these guys will go and form like leukotrienes. And then, there's a leukotrienes number like B4, and there are all the others in leukotrienes number E and all. So basically, some of these leukotrienes are neutrophils. They're chemotaxic. They attract neutrophils. And when you do immunology, we'll talk about that. And there are also some leukotrienes which are bronchoconstriction. Okay, when you do the respiratory, we'll talk about that. All right. But right now, I want you to focus on this pathway, this cyclooxygenase pathway, which leads into formations of thromboxanes A2. And what is the thromboxane A2 does is that thromboxane A2 is a powerful constrictor. It can constrict the smooth muscle cells, and what happens is that it can prevent stop bleeding. Right. That's what it does. All right, that's one of the functions of thromboxane A2. And then there's a prostacyclins also formed, because remember, there's another function of thromboxane A2 is like this thromboxane A2 and prostacyclins. Every single day in your human life, there's some amount of thromboxane and prostacyclins floating in your blood. So these guys, sort of like because of this too, balance it out. That's why it helps to, it's kind of like circulate your blood in your liquid form, okay? Because this one is thromboxane A2, it's procoagulant. This is anticoagulant, like this one, prostacyclins, right? because it doesn't allow to coagulate to form, right? It doesn't, like thromboxane wants to do a thromboxane, it wants to coagulate, right? This is a platelet aggregator. This was antiplatelet, right? That's what this is do. And the cyclooxygen pathway lead into it. And there's sometimes there drugs works into this cyclooxygenase, right? If you want to inhibit the cyclooxygen, we give them NSAID, like ibuprofen. You can give them. You can give aspirin. All right, this aspirin can inhibit the acetaminophen that can inhibit the cyclooxygen pathway, so you're not able to do form a thromboxane. All right, so this is the path that lead into forming this. All right, so this is what I wanted to tell you guys. Now, after this, what's going to happen now? Let me erase this, guys. Now, what happens is that now, as this platelet is getting swollen up, let me make this platelet really big, and then this platelet has swollen up. What happens is started releasing platelet reaction, like it started releasing from there, and they have like granules. Like one is called, like they have this delta granules or dense granules, or the other one is alpha granules, right? They have this, and then if you talk about delta, let me write you delta granules. This delta granules started releasing some of the substances. One of the things they release is serotonin. Like serotonin they release, right? They release epinephrine, serotonin they release, right? And then they do constriction, right? And then they obviously they release also ADP right here, okay? And then they also release, what is the other? They release calcium, all right? So this is what you have to remember, right? Remember, they release epinephrine also, if you want to remember extra. All right, and we'll talk about its role. What is the alpha granules release? They release something called platelet-derived endothelial growth factors. Guys, you have to remember this, because remember, this platelet-derived endothelial growth factors is important for like proliferations of your smooth muscle cells. They proliferate the fibroblasts, like this collagens. Okay, and remember, like maybe if you learned that, you know, your muscles does not go through the process of mitosis. Yeah, that is true, but this is exceptional where, you know, this on the influence of platelet derived growth factor, this process does go to mitosis, or they do proliferate, okay? They do proliferate, so they do proliferate, and they help the remodeling of the cells. So that way, whatever the injured cells are, you can regrow and then remodel, and they can be fixed. All right. So this, under the influence of platelet endothelial growth factor, they do that. All right. They also release like some platelet factors, PLAT platelet factors, like number 3. We'll talk number 5. These platelet factors, these guys release. All right. So platelet factors, some clotting factors which you just talked about this, right? Right, and then these are very, very important concept for you to remember, because these guys are always